colleagues, and welcome again. Good to see you. It's good morning from Lagos, Nigeria. My name is Olaide Akoni, and I'm the host for the show VUKA Africa, which simply means Arise Africa. This show is put together by WACI Health, which is the host of the Global Fund Advocates Network, GFAN Africa. And today on the show, I have a special guest. His name is Luazi Mlaba. Luazi, welcome to the show. Good to see you.
Thank you very much. Thank you.
Okay, great to have you on the show. Luazi is the CEO of Zulo International, and he's also the co-founder Pan-Africa COVID-19 Survivors Platform, South Africa. Great to have you, Luazi. And on the show today, we're going to be discussing a whole range of issues, talking about COVID-19, its impact on HIV, TB, and malaria, as well as other things that we will want our governments and key stakeholders to take into cognizance as we fight the three diseases, as well as put an end to COVID-19 within our respective spaces. So, Luazi, my first question to you. COVID has had an impact on HIV, on TB, on malaria. What are the mitigating activities or interventions that you think governments, civil society, and key stakeholders need to put in place to ensure that the gains that we have achieved on HIV, TB, and malaria are not reversed as a result of COVID?
Thank you for the question. I think it is important that communities in times of COVID continue to have access to their services for HIV, TB, malaria, and STIs, but we make sure also that we protect our adolescent girls and young women. And therefore we need to embed human rights response in times of COVID-19. We still need to make sure we get data on the ground as to what is happening, what sort of interventions need to be amplified. And so we need community-driven and civil society-driven interventions because they've got the hands on the ground. Political will is very important in these times to make sure that domestic resources are mobilized for the response to COVID, but also to make sure we do not lose the gains that have been gained against HIV, TB, and malaria.
Thank you so much, Luazi. When you talk about community-driven interventions, can you be more specific about, for instance, as we're looking at linking HIV and TB and malaria interventions with COVID-19, getting tested for COVID-19, what are the specific community-driven interventions that civil society can take on board from your experience?
My experience in South Africa, we've had lockdowns during COVID-19. And so that meant the only people that had access to services were people that were either tested positive for COVID or were going into hospitals for COVID tests. And that disrupted access of those that have to get their tests for HIV, TB, and malaria, or get their medication for TB and malaria. And so community entrenched organizations are the people that can give us indications as to what do we do in times of COVID to make sure that there is continued access to services for communities.
Thank you. Communities know what is best for them, and they can best advise us on how to better program because there's no one size fits all. Thank you again for highlighting that. Now, you know, there's a lot of talk. Several countries in the developed world have come up to say now there's a vaccine. They've come up with vaccines for COVID-19, and there are a whole lot of concerns about the rollout. When we talk about COVID-19, I know that the UK, for instance, has talked about the fact that they're going to start rolling out a vaccine very soon. What are the things that we need to do within our space, particularly in Africa, to ensure that as many people as possible get access to these vaccines?
I think the first reality is that we are not going to get the vaccines as much as we want in Africa. We are middle and low income countries. And unless there is a huge global political drive to make sure that there is equitable access to vaccines and that the pricing is right, all we have to do right now is make sure we keep wearing our masks, we avoid mass meetings, and I think we stick to the known Africa CDC protocols with regards to the response to COVID. As far as vaccines are concerned, can you hear me?
Yeah, sure, continue.
Okay, so as far as vaccines are concerned, I think there's protocols with regards to who get the vaccines. If you've got comorbidities that put you at risk, likelihood is that you are possibly the first person who is likely to get vaccine. So people over a certain age, people with comorbidities, and it will not be for the general population, and that's the reality. So even in the UK, the patients that got the vaccines were the older generation to make sure that they are protected against COVID. And so there's some reality check that we need to do with regards to what does it mean that now we've got vaccines available.
Thank you very much. I particularly like the fact that, you've highlighted the importance of the reality check, that we need to know who to prioritize, understand that, there are priorities being given to certain populations. And we also must not do away with the preventive measures that we are sure of. We still need to adhere strictly to those preventive measures, while we also look at, supply chain and all the other logistics that need to be put in place for distribution to the various populations. But you also raised a very important point about equity and pricing and a whole lot of other things, which takes us to the next question, which is about universal health coverage. So December 12 is commemorated worldwide as Universal Health Coverage Day. So as we prepare to mark UHC Day, given the context that we're in, what are the things that our governments need to be putting in place to ensure that, despite the challenges that COVID-19 has placed in our way, we are still able to achieve universal health coverage by 2030?
I think the first thing, and this is for me very, very important, that we don't just celebrate our frontline healthcare workers, that we make sure that they are protected and there's an investment in the work that they do, because they are at the front lines of fighting COVID-19 and all other pandemics or epidemics. And so resilient and sustainable systems for health needs to be understood and embedded as a response, primary response. And that means, therefore, that domestic resources must be mobilized by both ministries of health and ministries of finance to make sure that health is invested into appropriately. And above that, we need to make sure that we understand that we should leave no one behind, and that communities must not be driven into poverty in their pursuit to access primary health.
Thank you very much, Luazi. I like the things that you have highlighted. You've talked about resilient and sustainable systems for health. We know that COVID-19 has undermined our health systems greatly in many of our countries in Africa, and we really need to work towards rebuilding and strengthening the health system. Secondly, also highlighted the importance of domestic resource for health. We cannot underscore that. It has to be emphasized. Rather than cutting back on the investment to health, we really need to be doubling up effort and doing much more right now. And one of our guests on the show, or one of the people watching the show, has also highlighted the need to ensure affordability, availability, and accessibility in Africa. So accessibility in terms of healthcare services, availability of the services, and affordability. And that cannot occur without us committing to strengthening our assistance for health across Africa. So thank you very much, Luazi, for those wonderful comments. Now I will open up for questions and comments from our guests, people who are watching us all across the world. If there's anybody who has any question, please feel free to drop your questions in the chat box or your comments in the chat box so that our guest on the show can also speak to that. But while we wait for comments and questions from our guests, Luazi, is there any other thing that you would like to share with us about COVID-19? Because, you know, even as we're seeing a resurgence of cases in Europe and in some of the other parts of the world, there's still people who still think that, you know, COVID-19 is a myth, that there's really nothing to worry about. What would you say to such an individual?
I am a COVID-19 survivor, so I'm living with long COVID symptoms right now. And so even if I did not believe there was COVID before, and I had the likelihood of believing that, we've got a lot of news media coming in from the US, and it was confusing for the most part. The president of the United States was saying something else, WHO was saying something else, so it was confusing. We were not sure, what are we dealing with? How do we need to respond to it? Africa CDC has given us protocols to follow. Wear your mask, avoid, I think, highly concentrated spaces, wash your hands, sanitize. We've got to keep to that simple protocol. If you do not have your condom on, you do not have sex. It's simple. It is that if it's not on, you are not in. If your mask is not on, you are not out the door. It is really that simple. And I think it is important that we also understand that I think my fear is that a response that does not speak to long COVID will not completely deal with the issues related to COVID-19. And so there's research that still needs to be done in terms of how does it affect a survivor, COVID-19. We've got an entire group called Pan-Africa C19 Survivors. Every day we are talking about the symptoms that we are experiencing. I will be in the next meeting with the UK research group with Oxford University talking about COVID and long COVID response, and sharing the Africa experience of long COVID. It was April that I thought I was going to die. It is painful. It is isolating because you've got to be by yourself. I do not wish it on anyone. And so all of us need to take it seriously. But that does not mean we need to forget that there are sufferers of HIV, of TB, and malaria, that we still need to make sure that they've got their services available to them, and there is no out-of-pocket expenses, as all of us are wanting to access primary health.
Thank you, Luazi, for sharing so passionately your experience and bringing the reality of COVID-19 to the fore. We have a question from Angela in the chat box, and she's asking, what is the role of civil society in domestic resource mobilization? We've talked a lot about the need for domestic resource mobilization to fight the 3 diseases as well as to fight COVID. So what is the role of civil society? What can they do to help to mobilize domestic resources?
Drum beating. I think a civil society plays a big role in reminding governments that there's agreements that were made, and there are scorecards that they are measured against, and that there is goals that must be met. And civil society is perhaps best placed to hold governments accountable. And so we need to understand health financing, and we need to understand each line item, what it means, and how the monies are spent, where they are spent. And that's important. And I recall we had a session in Kenya, Nairobi, facilitated by WACI Health and Global Fund. It was an eye-opener in terms of health financing, what exactly does it mean? What should we be looking for year on year? And that's very key.
Thank you. And like you rightly said, it's also important that as civil society, we're also looking at the budget. What are our budgets? What are our governments allocating to health? What are they allocating to education? And what are they allocating to defense? You know, understanding the budget process and how we can engage much more proactively is also a very important step in that direction. Thank you again, Luazi, for being with us, for being part of the show, and for emphasizing again the need for us to know that COVID is not over and we need to protect ourselves, particularly as we go into the Christmas and the New Year season. Oftentimes people want to gather together and as family, as friends, and relax, and it's often easy to throw caution to the wind, but we know that COVID is not yet over. So if you're going out, you need to wear your mask, you need to have your hand sanitizers with you, you need to ensure as much as possible you put in place protective measures, you protect yourself and you protect your loved ones. Thank you again, Luazi. Any final words from you before we end this session of the show?
We must step up the fight and continue drum beating for universal healthcare, as well as achieving SDG 3. We must fight and eliminate the 3 pandemics, HIV, TB, and malaria. We are in good hands. We really are. We can beat this. We can.
Thank you, Luazi. And on that note, ladies and gentlemen, we're putting a wrap to this edition of VUKA Africa. Thank you very much for being a wonderful audience. And thank you, Luazi, for taking time to share with us. We really appreciate your time and your insights on this. Thank you. Take care. Bye.